Congressman Ed Case, thank you for making time to be with us, sir.
Thank you so much for being able to be with you. As you can tell, I'm in Washington D.C. unexpectedly, so apologies that I'm not in my aloha shirt, but here you have me.
Yeah, well, I appreciate you've got big duties, and of course, we're recording this on Wednesday, the day before our conference together on Thursday. We got a lot to talk about. Let me just ask you to bring us up to speed on a few of the things that I know you've been working on and watching.
I mean, first of all, I do really appreciate your asking me to join you today, and I wish I could be with you through the entirety of your conference, and I'd love to hear the results. Healthcare is such an incredibly important part of our entire country, especially in the midst of COVID-19, where we have stressed the heck out of our healthcare system, and where we obviously need to take a look at where we need to improve it. And learn the lessons of COVID-19, even as we try to get through it. I think for me, on the national level, not only am I focused on solid, sound national healthcare policy, and of course we have many, many issues to deal with there, but healthcare in Hawaii is unique. I know this from spending the entirety of my life in Hawaii. I represented the 2nd Congressional District, my first time in Congress, which is. And then, the challenges of administering a solid and inclusive and safe and professional healthcare system across a chain of islands in the middle of the Pacific is problematic. So I really appreciate the approach to stepping back a second and taking a look at the big picture and coming back with reforms that will work not only for the state, but that we can contribute at the national level.
Well, I know you've spent a lot of time on planes in your political career, and a lot of time on planes even this week. Of course, we appreciate very much that you were willing to be with us, sort of live at our event, but the national events have dictated that you return back to Congress this week for some key votes. Tell us about the solemnity and the process related to impeaching a president for the 2nd time in his term, and what's going through your mind, the mind of your colleagues this week as you've taken that vote.
Well, I'm sad. This is not a joyous vote. This is not a joyous occasion. This is not a joyous time for our country. I never expected in Congress to have to vote to impeach a president. I didn't come back to Congress with the intention of voting to impeach this president. I never in my wildest dreams thought that I would have to vote twice. First time in our history to impeach a president. And so the fact that I'm kind of in rarefied company in terms of the 11,000 or so citizens of our country that have served in the U.S. House of Representatives in impeaching, I take no joy out of that. And nonetheless, I believe that the president's incitement to the violent assault last week on our U.S. Capitol was in violation of his oath of office. Not only did it have real consequences, of course, in the deaths of our fellow citizens and the desecration of the foundational building and institution of our democracy and the embarrassment in the world, but that is not consistent with an oath of office, which is to defend the Constitution and to protect the American people. And so it's a very, very difficult vote, regardless of how you feel about it. I hope that each and all of my colleagues would feel the same way, and I believe they do. And so it is it's a very dark chapter for our country. It is a difficult time for Washington D.C. and for Capitol Hill. We are in the middle of massive increased security precautions, as an example, and we're preparing for an inauguration in just a few days. So it's not a normal week or a normal month in Washington, D.C., that's for sure. It's a month of consequence to our country, and it's a time for us all to reflect on what has gone wrong that we got to this point, and what can each of us do to try to make it better for our country and for each and all of us as American citizens, because that does bind us together.
It does feel like, 2020 has been a heck of a year, but it feels like the broader American ohana is sort of having to deal with the trauma of watching these attacks on our American democracy last week on the 6th. Where were you when the riots became an insurrection, or rather the protests became riots and the riots became insurrection? Tell us about what you experienced last week when that happened.
Well, I was in my office, and let's not forget that on that day, that was a consequential day for our country, because Congress's constitutional duty is to certify the results of the Electoral College and the next president of the United States. Most of us don't know that process exists, because on the vast majority of situations throughout our country's 200 plus year history, Congress's job has been to make sure that nothing went awry, and didn't question the Electoral College result. And that was obviously different on the 6th, when after months of the president saying outright that the election was invalid, despite all evidence, despite court cases to the contrary, and despite the Electoral College itself, which is administered by each of the states of both parties, that assault, I would say, on the election process was happening that day. And of course, that's why the protests were here. And I and everybody else expected that we would have protests. So that's the right of Americans to protest, even if we violently disagree with them. That's the wrong word to use, but even if we strongly disagree with them. But to expect those assaults, physical assaults, and death, and vandalism, and theft, and again, destruction of much of our foundational basis, was a full day, and it happened. I was in my office because during that debate, because of COVID-19, we are not supposed to assemble on the floor of the House unless it's to vote. And so there were a very few number of members of the House that were actually on the floor. Most of us were in our offices, exactly like what you see me doing right now. I was watching the debate on the live feed right behind me, and trying to make sure that I agreed that the result was a valid result. And as I watched that debate, I could see at one point that something was seriously awry, just because of the activity on the floor, and it was very unusual. And then I could hear, of course, the assaulters trying to break down the doors of the House chamber, and then that live feed went silent, and then the external media told me what was happening, and I started to get the notifications on my phone, the emergency notifications, which are very, very rare. They're supposed to be only for true emergencies, saying there's an assault taking place on the Capitol, there is danger, stay where you are, shelter in place. And that's what I did for the next several hours until the events occurred, and we could return to the business of affirming the election results. And so it was an emotional time for me. I struggled with the consequences of this to our country, to our Constitution, and obviously needed to communicate with folks back home, not only that I was safe, but what I felt was going on and what we needed to do about it. So it was a difficult day, but I was in my office for most of it.
Yeah, well, thank you for your service. I mean, sometimes that's a phrase that gets thrown around a little bit, but as somebody who believes in our American form of Republican democracy, I really appreciate that folks like you are out there just doing the regular work of making sure our voices are all heard, and so thank you for that. So
I appreciate that, but in the same spirit, thousands of police officers put themselves, and others, National Guardists, put themselves in harm's way to protect me and others who are simply the representative folks in our government. Nothing special other than that we are the designated representatives, but they're the ones who are really on the front lines.
Yeah, I do want to obviously talk about healthcare and health policy. I just sort of struck by this unique nature between the vote that happened today, the unique nature of the time in which we're having this conversation. The vote for impeachment today, the 17th on Sunday, there are threats of nationwide protests in support of President Trump. On the 20th, we'll have the inauguration at 7 o'clock a.m. Hawaii time, but noon at an Eastern Standard Time. Give us maybe just a sense of what you think we should be watching for, particularly, way out west. What should we be watching for as the events unfold over the weekend on the 20th? Are there things that you think we should be keeping our eye on to better understand some of the things that will be happening on the ground in Washington, D.C.?
Well, Congress itself has adjourned at this point, so we don't expect any legislative business between now and basically the inauguration. And I guess anything can happen, but Congress itself will be quiet. But what you will see is a massive protection of the United States Capitol and significant security measures beyond anything we've seen before in Washington, D.C. And of course, in preparation for the inauguration, because number one, we have to be safe about this. We can't take anything for granted, and we know that from public pronouncements by some of the groups that fomented in conjunction with the president the attack on the U.S. Capitol have said what they intend to do. They intend to prevent Joe Biden from taking the presidency, and they intend to disrupt the inauguration, and they intend to protest at state capitals across our country. And so I think we need to take that seriously. That's not to be taken lightly. I hope and believe that the threat will not become reality, given that the vast majority of Americans don't agree with that approach. And second, I think both federal and state security folks are taking it seriously, and so there will be security measures in place to presumably dissuade any outright violence. So I would watch for whether that actually does happen anywhere in the country. And other than that, I hope that most Americans will in some way, shape, or form celebrate the institutions of our country and the peaceful transition of power, which is our hallmark.
Yeah. So let's move into the dry area of health policy for a minute. Give us just a rundown of some of the priorities you have for the upcoming Congress, and differentiate, if you would. First, start about the things that you're working on specific to Hawaii, workforce development and other things, and then maybe talk about the things that the Democratic conference, the Democratic majority in the House may seek to do related to health reform over the coming months.
Well, let's start with the observation that health reform has not particularly been on the table of the current administration for the entirety of this administration. That this administration was basically sworn to dismantle the Affordable Care Act, and so much of the work in Congress in the big picture has been either you want to dismantle it or you want to defend it and improve it. And so the critical parts of the Affordable Care Act to include protection against discrimination for pre-existing conditions, or the expansion of marketplaces that brought tens of millions of Americans a form of health insurance that was not available to them. Those were the front lines of the last few years nationally. It, as we all know, has not played out as much in Hawaii because of our prepaid healthcare act and system, where even before the Affordable Care Act, we had one of the highest utilization rates in the country. Nonetheless, there were still tens of thousands of our fellow citizens that did not have healthcare and/or unaffordable or unavailable, and that number has only worsened since COVID-19 because that, as we all know, is primarily employer-based. And so from a national perspective, I can answer your question in reverse. The new Biden administration, we're not going to have to fight that battle anymore. We're going to try to figure out how to improve the Affordable Care Act, and then we have to figure out where are the next frontiers of national policy healthcare. President-elect Biden has, for example, endorsed a public option in Medicare, and I believe that he is correct, at least for a certain age group, and so I do believe that there are debates to be had there. The intention of which is to expand healthcare for Americans. We have Medicare for all, so as it is sometimes referred to. That is a debate point in the country, and we're going to have to work through that. Of course, we have COVID-19 also, and that's not going away for the next Congress. That's going to be number one, and there I think there are two primary issues. First of all, we're going to have to continue the manufacture and distribution of vaccinations throughout our country. to include Hawaii. That's a federal responsibility primarily on the manufacture and distribution, but still a state responsibility for inside the state distribution. That's been a little jerky in Hawaii to date. And so where the federal government can help the states to do that, that's what we have to focus on. And then I think the second area that is going to dominate is in the COVID-19 department is, of course, COVID-19 is not a static virus. It is mutating. We are seeing different variants, and we're going to have to stay on the frontiers of science. And that's going to take significant federal investment through our national scientific institutions and our private partners to be sure that we head that off at the pass and do everything we can to find the scientific solutions to COVID-19, which during the current administration we're not always focused on. So that's national policy. And then on the Hawaii front, all of that is critical to Hawaii. The areas that I am particularly focused on in Hawaii, of course, are physician and other healthcare professional shortage, which is chronic and is substantially worsened by COVID-19. As we've seen, hundreds of, for example, doctors decided they couldn't continue any further. Great stress on professions that are more reliant on a non-COVID environment, non-emergency, medicine, for example. We see great stress and opportunity in telehealth, and these are areas that I think are particularly productive for Hawaii. Very, very specific issues are the Medicare reimbursement, which for Hawaii is a crime. The Medicare reimbursement is chronically low for Hawaii in an astronomically high cost of living, cost of practicing atmosphere. We made a lot of headway in the last Congress in my office in trying to ask the basic question, is the formula incorrect because they're relying on incorrect data? That would seem to be a simple question to answer, but it's not so simple. And we've had to spend a lot of time with CMS in getting them to understand that when you have a reimbursement formula that is so low compared to the rest of the country against a cost of living state that is so high, something is amiss. And I think we're going to have to continue to focus very hard on that. We need everybody's help on that, because what we need is evidence. CMS basically said, well, then give us the evidence of why your physician costs and healthcare practice costs are high. I mean, exactly what is it that's so high? Some of it's obvious, like, shipping equipment from the mainland. We've got extra high shipping costs, but some of it is not quite so obvious, like, the costs of leasing office space, et cetera. And so we really need the profession's help in terms of quantifying that, so we can make the case that the formula is not in any way, shape, or form working. And then I'll go back just for a second to telehealth, because that is clearly one of the answers to us in the long term in an island state where we cannot, we just can't afford to put a Queen's hospital on every island. So we've got to rely on a remote telemedicine where we can, to deliver high quality, high expertise, immediate healthcare attention to communities that don't have ready access, whether they're geographic or income related, non-ready access. So there's a lot of unfinished business there, to include some things that you wouldn't usually associate with this, such as the simple availability of broadband throughout our state, which is not available throughout our state to support telehealth.
Yeah. A lot of good stuff there. I know we're short on time. I want to just ask you this last question. Look for your short answer on this, but how can our audience, the folks gathered at State of Reform, people who are, across the board and across multiple silos, senior in healthcare and thinking about the intersection of public policy and the healthcare sector, what can they do to help support your work? How can they add some wind to your sails?
Well, I think the number one thing is for us to talk with each other. I deal with all kinds of issues in Washington, D.C. Healthcare is a critical issue, but so is national defense, so is environmental protection, so is, I could go down the list. And so I need partners, and I need partners that know a heck of a lot more than I do about issues. And I need partners that have ideas. that I can try to pursue here in Washington, D.C. So number one is communication, I would say clearly. And then number two, to develop a familiarity with working with getting information from my office to help with your own reform thoughts and efforts, and get into a working rhythm with me and my staff. Many of the folks that are going to be watching this have a great rhythm with me in my office, and I appreciate that. But I need more of that. And so, the easiest way into my office is case.house.gov. And you can start the relationship by emailing me or contacting me however you want with your concerns, your ideas, especially on federal issues, because of course, many of the issues that you're dealing with in healthcare policy are some combination of federal, state, county, managed care, local institution issues. I only have directly the federal side. Sometimes I wish I had more because it takes a little bit of time to communicate and coordinate. But I need the federal ones because I can especially work on that. So that's Medicare, that's the Affordable Care Act, that is national student loan debt, for example. There are a lot of issues that are federal, but just give me your ideas and I'll sort it through. So that's what I need.
Congressman Ed Case, sir, thank you very much for making time to be with us and our audience. Mahalo, and keep doing the good work.
Thank you so much, and best of luck in your conference.